All right, so thank you everyone for joining today. We have Kate Montgomery here with us today. I had the pleasure of touring her and Sam Martinez, who's going to be presenting next week. Earlier this year, we've connected a couple times and they were able to come out on campus and walk around. And we were lucky enough to get this presentation out of that connection. So I am going to pass the reins over to you, Kate.
Awesome. Well, thank you for having me. I am a Charlotte native, and so I've known about John Crosland for a long time, and I'm really excited to kind of be back in the community as a professional and able to kind of work together to give everybody resources. Before we get started, just to kind of introduce myself a little bit further, I left for school. I've recently come back, but I myself am a sibling. So my family in the Charlotte community went through the process of figuring out what schooling was going to look like, what all of the logistics were going to be. And so this is really a passion project of mine. So I really love the opportunity to kind of share with everybody the information I know I wish my family had had, and hopefully it'll benefit yours as well. So let's share our screen. Can everybody see that?
Right now we are seeing there we go. Now we can see it.
Can you see it?
Yep.
Wonderful. Okay. So kind of to go a little bit into what I hope we take away from this presentation, are kind of what are the needs of siblings. I always bring this up because I am a research person. I love kind of having the data, and I also think it's really validating because oftentimes working with families can be a really isolating experience. And so hopefully it's validating to know that there are lots of people who experience a lot of the same opportunities and challenges that your family is. And so that way you can kind of see that you're not alone and that this is all very, very normal. I also want to talk about what the sibling community looks like in Charlotte and what programs are available to support siblings.
Okay, I'm sorry to interrupt you real quick. When you hit full screen, we weren't able to see anymore.
Oh, well, we're going to see how it goes. Can we see this one?
Yes.
Well, then it's a little less professional. Thanks everybody for bearing with me. Here we are. So again, this is really research based, but what I hope we kind of take out of this is there's a study done in 2010 of what parents think siblings need in terms of being a sibling and what that looks like. And you'll notice that 60% of families are worried that there's a negative response of being a sibling. I do want to point out that almost 40% of the positive effects as well, but I think that this does a really good job of kind of highlighting some of our concerns and how we can be intentional about that. I also really like this study because they asked siblings what they were looking for. So the reality of being a sibling and being a member of this community is that there are finite resources, right? We don't have all of the time, the energy, the money. We have to be intentional about how we build supports in for our siblings. And so I really share this information with the goal of being intentional of what are our siblings actually asking for. So you'll notice some of these categories I think we often don't think about. Obviously, sibling support is helpful, having community, but also education. So lots of times there's materials about how to talk to a child about their diagnoses, how to talk to parents, but sometimes we forget that piece of educating their sibling and what that's going to look like. Inclusive family planning. I've worked with several families who have concerns about what caretaking of their sibling might look like in the future. And so if we, with just a little bit of education, we're able to really kind of change their perspective. So hopefully this is all resonating with you of things that you maybe have in mind. And it is important to note that being a sibling does impact social functioning, emotional functioning, physical functioning, school functioning, and quality of life. Okay. However, that is what happens when we have no intervention. So the goal of this is to point out that while yes, these things are very real and you are not alone, and it is perfectly normal that they may be happening in your family, we can absolutely intervene to kind of change some of these numbers. So what does our sibling community in Charlotte look like? I've hyperlinked to our sibling community a website, which is the Sibling Support Network. So you will actually be able to type in your zip code and find sibling support groups near you. So I'll make sure that I share these slides with Carrie afterwards and we can share them with everybody else. But I think it can be really helpful to recognize that there are resources that exist specifically for the siblings and how we can be helpful there. I also want to point out, obviously, the John Crosland School is serving you and serving your student, and therefore there's also siblings. So lots of times when we think about building our community, we think about how wonderful it is that our student at the John Crosland School has finally found a community that fits them, that makes sense for them. And I just want to put in the caveat that that also means any child at the John Crosland School probably also has a sibling that your other kiddos may benefit from. I also think it's just helpful to put in perspective that there were over 16,000 students in CMS who were served under IDEA. And so if we assume that every single one of those students has just one sibling, there are significant numbers of people in our community who may be able to provide that support for you. I also just like to point out, these are the percentages of the diagnoses that were served. And the percentages that were served in CMS somewhat mirror the percentages that are served at the John Crosland School. So there really are other families in the community who may be understanding your experience. It just might be hard to find them. And so that's the goal of sibling programming, to solve some of those problems, to provide some answers for who is your community going to be, who are the people who understand, because what we know from a research perspective, that it's social intervention that changes all of those factors at the beginning in terms of quality of life. So I kind of just want to pause for a moment and kind of come back together. I'd love to know everybody's kind of initial impressions to knowing we're not alone, knowing that all of the things that are happening are perfectly normal, and are there any specific concerns that maybe you're worried about or feel like there isn't anybody to talk to?
And again, if you don't want to unmute and be identified as the sharer of that, please feel free to drop it in the chat and I can be the mouthpiece that is sharing that concern, that thought, that fear, that question.
I know one I get a lot from families is, how do I provide more support? Like, I'm giving everything that I already have to my one particular student and there isn't really a lot left. And I think one of the things that's most beneficial in terms of finding community is, well, I've run Sibshops, which I'll speak to more in a few minutes. In my particular office, I often come out into the waiting room and notice that just the parents are so relieved to have the opportunity to speak with other community members.
I think that a concern that I myself have of a parent of two with very different needs is the balance and helping them understand the balance. Like one, just for a simple example, with even them needing opposite things. Like my daughter, we get home from school, she can't have multiple snacks because then she will not eat dinner. My son, on the other hand, needs a constant intake of food or else he's a nightmare and he still will eat his dinner. And so just getting that balance, that how do I explain this to them, that I'm trying to meet their needs, but their needs are different. Like it's just such a complex thing.
Absolutely. It's the difference between equality and equity. And so for a lot of our kids, we're super rigid. So any kind of flexibility in terms of the experience that they're having can often be met with some pushback, is maybe a kind way of describing the reactions. But I think that's really where the education piece comes in. And that doesn't mean that we necessarily give all of the information. Obviously, we need to be mindful of what's developmentally appropriate. But even just explaining like, hey, this is something your sibling's body needs, and this isn't something your body needs. But sometimes without that direct instruction, they don't know or they're not aware of why. And so then it might feel personal, like mom's choosing brother over me, because we're not going that next step and explaining, well, this is what brother's body needs to be successful, but this isn't what your body needs. I'm going to go back into present mode and kind of walk through what Sibshops looks like. But I just want to be super mindful of making sure that any questions that you have are hopefully answered. And again, just hopefully validating that this is not a unique experience. We are able to find community, and really that's what's most important here. All right, hopefully we can still see. Carrie, are we good?
Yes, we're good.
Wonderful. Okay, so sibling programming. I'm going to focus on Sibshops because it's the evidence-based program that currently exists to support siblings. And I am what's considered a level 1 facilitator, meaning that I've gone through enough training to be able to train others to participate in this community, but it is certainly not the only option. We are lucky enough in Charlotte to have 4 different Sibshop groups. And so there's some up in Lake Norman. I believe there's one that's opening in Cabarrus County. I'm in South Park, and there's another one that's a little farther south as well, towards the Matthews area. So hopefully there's one that's somewhat close to you that's going to be able to kind of provide your family with support. So Sibshops was started at the University of Washington in 1978, and it is very slowly making its way to the East Coast. My training was done in Philadelphia, and there's a Sibshops at CHOP, the Children's Hospital of Philadelphia, which provides support for that particular community. But it's important to think through Sibshops as a program that's designed not only for medical concerns, but also for neurodevelopmental concerns. So really, I give the example of any sibling where one may require higher support needs can find a place in Sibshops. It's also helpful to know that Sibshops is the outreach component of the sibling support project. So while I'm not going to go all the way down into the sibling support project because that would be an entire presentation on its own, that's a really great resource in terms of kind of finding information, finding ways to talk about it, finding professionals who might understand or be able to help. And so that is hyperlinked to this photo as well, which will hopefully be helpful. So what is Sibshops? There's 5 goals that all Sibshops adhere to, but it's really important to think about the fact that every Sibshops group is able to differentiate for the population that they're serving. For example, the Sibshop in the south of Charlotte is really focused on siblings of autism, versus others might be open to different populations. So the goal is to provide the opportunity to meet other siblings in a relaxed setting. So often our siblings end up spending time in waiting rooms, in hospitals, in doctor's office, in med management offices. And so it's important that they know that they have their own environment as well. And I've even have some come in and are so relieved to be able to be like, well, this is my appointment. And there's a lot of pride in that. It's also an opportunity to discuss common joys and concerns with other siblings. So it may be the experience of your sibling that they don't have anyone, or they don't have a peer who really understands what their experience is like. I really like Sibshops because we look at not only the concerns, like we were starting at the beginning, but also the joys. So one of the things that the research shows of families with siblings, one maybe having higher needs than the other, is that there's often a significant source of family pride. There's a lot of loyalty, there's a lot of maturity. Often siblings go on into helping professions in their communities. And so while it certainly can be a challenging experience, it also provides the opportunity to learn empathy, to learn advocacy skills, and those are wonderful things that are going to continue to serve these siblings through life. Sibshops is also the opportunity to learn how to handle situations commonly experienced by siblings. So one of my favorite examples from the group that I ran earlier this fall was, what do we do when there's a babysitter and maybe the babysitter doesn't know our normal routine? And so I can handle my sibling when mom and dad or whomever is home, but as soon as there's a babysitter, they're not here, and now I'm trying to figure out what my role is because I know that this isn't the right way that we do things, but they're the adult. And so providing the opportunity to talk through what we might do, even though some of the suggestions may not be helpful, so we certainly still need some adult intervention sometime, can be really kind of helpful in terms of siblings being able to bounce ideas off of each other. I know as adults, we often feel like we have to provide the answer to the question of what to do. But we know for so many that feeling empowered and feeling as though they were a part of the solution process makes them feel really bought in and, again, empowered in these situations. So I really love when my siblings come up with ideas together and then they go out and try them and they come back and we report on what worked and what didn't work and what might we do differently next time. There's also the opportunity to learn more about what their siblings' needs might be. So, oftentimes, what happens in these spaces is that siblings will discuss the fact that they're worried about asking their questions to mom or dad or whomever their guardian is. So, we often do our very best to be as accessible as possible in our family systems. But there's the reality that parents aren't neutral. So, what that means is it might be hard to ask, well, why do we always go to the hospital when we know that you're already exhausted from already being there? Or if it's just driving around to all of the doctor's appointments or whatever that might be. Our kiddos are smart enough and intuitive enough to recognize the drain that it's taking on their adults. And so, providing them the opportunity to discuss those questions with another professional can be really helpful. There's also the opportunity for parents and other professionals to learn more. So, really, the goal of Sibshops is to be a community. It's the opportunity to bring in others in a space that is designed for our siblings. And as I mentioned, it's the story of the parents in the waiting room having the opportunity to share pediatricians who really understand their experience, or what's a great resource for maybe we need help with transportation and who are we going to be able to rely upon for that. So, really, the goal is to create community, to create the opportunity to work together to come up with solutions that are specific to their needs. I also really like this study because they followed children who participated in Sibshops as children into their adult years to find out what were the outcomes. So 90% of siblings report a more positive effect on their feelings towards their sibling. And I think that's really important because what we know is that so often there can be feelings of resentment, there can be feelings of guilt, embarrassment, not understanding. And so when we provide the opportunity to have the social connection to address how to respond to some of these things, we see a pretty significant change in how siblings view each other. Siblings are really important in their relationship because they are the partner through life. So often at some point they may become the caregiver, and they are the ones who are part of the community that whomever the child is growing up in. So this is going to be a lifelong relationship, and our goal is obviously for them to have a positive relationship with one another. 67% learned coping strategies. I really love this one because, again, it's the example I mentioned earlier of how do we work through some of these things. One of my favorite activities I always do with my Sibshops is a love bug and a what bugs me. And it gives the opportunity to, again, talk about what do I love about my sibling relationship and what are some of the challenges. And then we're able to work through, well, if we're all having this challenge, how can we move forward? What can we do? What can we try? 75% of participants reported that their experience impacted their adult lives. Again, we know often these siblings go into helping professions. It increases their empathy, it increases their community involvement. Being a sibling essentially is a fast track to being a positive contributing member of society. But also we have to think through how many siblings may become caregivers, how many siblings will just continue to be involved maybe in a different way in their sibling's life. And that's not something that ends at childhood, right? So when we think of sibling relationships where maybe there isn't a more significant need, so often after siblings don't live in the house together, that relationship changes. I joke with one of my siblings, our relationship improved dramatically when we no longer shared a bathroom. But it can just be really helpful to kind of think through that relationship is going to look different. It is going to carry most likely into their adult lives. And so how do we handle that? And 94% said that they would recommend Sibshops to others. And I think that that's really telling as well. I think part of what I really appreciate, again, is that consideration of not just what are we guessing or what do we as adults think that these kids are looking for, it's important to think about what are they looking for, what are they asking for, and maybe what are they even worried about asking. Okay, I know I just somewhat dumped information, so we're gonna take a break, kind of come back together, and think through what are maybe our questions directly about Sibshops, what are some specific situations that maybe it'd be helpful if we workshop together.
And actually, Kate, I think that at this point, I am going to stop the recording, just so people feel more comfortable kind of in this open conversation. And then actually we have one question that I want to include in the recording,
Yeah.
and then we'll turn it off. I did get the question, are there any in South Carolina?
Absolutely. So as I mentioned, Sibshops started at the University of Washington, and it has been making its way over to the East Coast. There's actually a huge movement in Australia right now with Sibshops. So there's some really great research coming out of there. But on the presentation where I hyperlinked, and I'll make sure again that Carrie has the slides, you can type in your zip code and find out what's available most closely to you.
And I will be, just so everyone here knows, later today, or whenever, Kate, you're able to get the slides to me, I will send out a link to the recording and to the slides as well, so you'll have those links. Okay, so thank you. I want to include a thank you in the recording, even though we're not done, before I stop that. But thank you so much for all of that information and for the workshopping that we're going to continue to do in just a moment. But I'm going to go ahead and stop the recording.